I met a Zambian obstetrician who was doing a master's degree at the University of Alabama. He invited my wife Elizabeth and I to come to Zambia for 1 year to work on a particular project in perinatal HIV, so preventing mother-to-child transmission of HIV. We were in no way prepared for what we would find when we arrived. At that time, there was very little treatment for people with HIV, although a tremendous number of pregnant women at the time were infected with HIV.
In 2001, there was so many people were dying from HIV when we first moved to Zambia. Testing was starting to become available, and so people would know they were HIV positive, but there was no treatment. And so it was almost like a death sentence.
We started working at the University Hospital in Lusaka, where 1 in 4 women who we would encounter were HIV infected. So we really went to work at trying to solve that problem. Right around the time we arrived, some new innovations became available with antiretroviral drugs that could be used to prevent mother-to-child transmission and also to treat patients. We converted all of our obstetricians and epidemiologists and laboratory people into infectious disease specialists. We got a grant from the U.S. government, and we had a mandate from the Zambian Ministry of Health to go out and treat as many people with HIV as we possibly could. The drugs are miraculous, so they take people who are literally on their deathbed. You treat them, and a large number of them actually got up and walked out of the hospital.
When we first started, I think there were less than 1,000 people on antiretroviral therapy or HIV treatment. Programs that under Dr. Stringer's leadership, as well as others, those programs reached more than 1 million pregnant women. By the numbers, there was a real amazing impact.
Over the 11 years that we lived in Zambia, treatment for HIV became the standard of care. The medicines that Zambians were receiving were the same medications that you get in the United States. People were living long, healthy, productive lives.
After we'd been in Zambia for about a decade, my wife Elizabeth and I decided it was time to move back to the States. It was not just me and Elizabeth, it was a big group of people who were part of our overall enterprise. And we decided to come to UNC-Chapel Hill, and the reason we did that, because it had this confluence of outstanding global health and this incredible OBGYN department.
So Jeff arrived and instantly was able to transfer exceptional funding portfolio for his work in Zambia and around the world to UNC, and then able to execute the use of those funds to make more and more discoveries. About 10 years ago, he became very interested in using technology to determine and avoid preterm birth. And so Jeff started working on what's called point-of-care ultrasound. Women who get pregnant in the United States, they go and get a lot of information about the baby through ultrasound 2 or 3 times during their pregnancy using a machine that costs hundreds of thousands of dollars. You might say, well, okay, but we still have these machines in the United States. No, we don't. There are places all over the United States and in North Carolina that we call obstetric deserts, where women are living hundreds of miles or at least tens of miles away from the kind of care that they would need to have an ideal pregnancy.
When we think about that, we're thinking about our rural areas where moms don't have access to something that we often think of basic. The work that he's doing more recently, using AI, artificial intelligence, it's a handheld ultrasound. It attached to your iPad. The information that's collected is then read by the AI. You don't have to have any training in order to collect this information. And so that's revolutionizing.
If you think about a rural health clinic in a less developed part of Africa or in rural parts of North Carolina, what Dr. Stringer has been able to do is make that technology more broadly available to a greater number of expectant mothers. We couldn't be more excited for him to receive this award. It's a true honor and well-deserved.